Hello, everyone. My name is Angie Wrightstone. I am the Director of Continuing Education at Firefly Hollow, and I'm very excited about this special interview that I'm bringing to you today. I have a special guest with me today. His name is Scott Korb, and he is one of our featured continuing education instructors that will be presenting a class on kinesio taping. So I wanted to bring this to you so you have a heads up on what to expect, what that class is going to be like, what the benefits are for you as a massage therapist, and reasons why you definitely need to sign up for this class. I know I will be there and I am excited about it. So Scott, welcome to my interview. And I want to start off by just having you introduce yourself. Tell me about how you got into this field of massage, and then how you got to the field of kinesio taping, and sort of what that journey's been like for you.
Okay, my name is Scott Korb. I am a graduate of Pittsburgh School of Massage Therapy back in '91. I provide massage therapy. For about 6 years, I was working full-time because I couldn't get into a full-time practice. In 1998, I got laid off in November, and from there I started my private practice. One of the things that I realized in being a practitioner is that I wanted tools for my tool belt. And so I started to seek and search for what I could use in my practice. I wanted to get results. I just don't want to do Swedish massage. And all massage is good, but I wanted to get results. So I found a clinical sports massage class, took that, and then subsequent to that, it turned into orthopedic and pain management massage. From there, it morphed, and I just took class after class after class because everything was evolving. So I wanted to try to stay up with the times. As I did that, I started realizing that there were more and more techniques out there that can make the results lasting longer. And so I found this technique called kinesio tape. And I got to tell you, Angie, I was serious, like, really, this stuff works? So I took an intro to kinesio class, and I was just totally blown away by the effects of the tape. So I'm like, wow, this is crazy. I have to take this class. Well, I did. And it has been an amazing technique for me. And so when I have clients come in and they say, oh, well, we're going to be together for a long period of time. And I tell them, well, no. My goal is to get you out of my office. My goal is to help get you to maintain your health and wellness. And they're like, wow. So I usually have clients come in once a week for a while, and then we tail it off to every other week and then every 3 weeks. And then they start realizing, oh, okay, now I can move about the whatevers or go back to my world, without much pain. So I actually often share with them that how they can tape themselves, or I bring in a significant other and I teach them how to do the work. And I have a lot of clients that actually have taken this kinesio tape with them on vacation when they travel. They get injured, their ankles and so forth and so on. And it's pretty amazing to see the results. So yeah, and then there's other classes that I've taken along the way to also help enhance. One is I took ACE massage metacupping because I realized that in massage, you're actually compressing the skin, whereas with the cups, you're actually decompressing the skin. So I realized, oh my, I'm not only lifting the skin with kinesio tape, but I'm also lifting the skin with the cupping. So I got amazing results over the last 2 years with my clients, and quicker results as well.
Wow. That's incredible. And it seems so simple of a technique. Is it something that's difficult to learn?
No, there's, can I explain this? Just like everything, you take a basic course You learn how to, I'll teach you in day one about the founder of Kinesio. We teach you the basic fundamentals of an I strip, a Y strip, an X strip. So you learn the different techniques, the web cuts, you learn different things. And what we do is we go over basic techniques, for people who have problems with their shoulders, problems with knees. We go real simple to show you how to open the tape up, anchor it, pull it down the direction where you end it. Then it's explained to you clearly that this is the anchor, this is your tape direction, this is your end, but the therapy goes back that direction. There's a recoil to the tape. Now, I explain to them, anywhere between 0% and 50%, you get a recoil. Anything from 50 and above, you don't get a recoil. It goes right down to where you want your therapy to be. So that is all explained to them in a step-by-step manner.
Wow, that's awesome. Is it something that you find is an added expense as a therapist? Is the tape expensive? I mean, how much do you go through? Are you using it with every client?
It is. It's not expensive. I know some of these medical or like CVS, our drugstores, they're starting to sell different types of tape. Kinesio doesn't sell to places like that. I actually have one thing going in my favor. When I first got into Kinesio, I actually, because I wanted to travel with other instructors, I became a distributor.
Oh, okay.
So I traveled with other instructors because it was important for me to learn from different instructors. So I traveled with this person, that person, and I became the distributor for them. So that kind of helped me out. It is relatively inexpensive as far as using a lot of tape. In the beginning, because I would fumbled over a lot of different things. Yeah, I did, because you want to make sure that you're not putting any shear on the skin. You want to make sure that you're stretching back, because the most important part of taping is having the client move to where they're comfortable. So if they're slouched over still, and I'm going to tape them, if they go to move their shoulder, it's possible they could shear the skin. So I'm very careful in being able to tell people that they need to make sure that the client stretches to their comfort level. So in the beginning, I have gone through a little bit more tape, and now I've gotten so proficient at it that whatever I'm using, whatever I measure for, I use, and I move on from there.
Awesome.
Yeah.
How is this tape good for the therapist, him or herself, as far as self-care? Is that something that you show, or is it something you use personally?
I will absolutely show. As a therapist myself, I use my tape constantly. So if I have issues with my thumb, there are tapings that you could actually take and there's what's called a functional correction that they'll learn near the end of day two, yeah. So there's a functional correction that you'll learn. There's also mechanical corrections that you'll learn. All kind of different corrections you'll learn in the second day of Kinesio. And basically, I use a lot of those different things for my thumb. I also do a lot of fascia taping for my forearms. I also do. I know a lot of us have lateral epicondylitis. Some of us have medial epicondylitis. I like to say it could be any kind of itis, but if I'll teach you how to tape your elbows. There's a lot of times where I know that I'm so forward while I'm doing my work that I've actually taken tape and put it on my underneath on my ribs, and I'll lay back and I'll pull the tape down, and what it does is it helps keep me erect.
Oh,
So,
wow.
oh my God, it's so amazing. Yes,
That's
it's
awesome.
in that way. The other thing that does for me, it also helps my breathing when I'm doing work, because it'll recoil me back and allow me to have that extra breath. And when I do my hands, when I take my hands, I normally take my hands in the evening, right before I go to sleep, because then it keeps my hand from balling up like this all night in a ball. And I get up in the morning, and almost nine times out of 10, the tape is going to come off because you're rolling around in bed. But I wake up and I have no pain.
Wow. Wow. That's incredible.
So I highly recommend it for the massage therapists in, that are going to, I've been doing this for 30 years. So I'm doing something right.
Absolutely. So are there other professions that can take your class or benefit from this?
Oh, absolutely. We get a lot of PTs in my class. I get a lot of OTs, athletic trainers. I've had chiropractors in my class as well.
Wow, that's
Yeah.
great. That is great. Tell me, how might your class be different from some of the other taping classes that are out there, if you know of them? I know that there's a rock tape class and some other no name sort of generic taping classes out there. How is yours differ from those?
The biggest part is the science behind the tape. That's the biggest part that I stress in my class. A lot of other taping courses out there they'll say that you don't really need a condition to actually, you can just tape, which doesn't make sense to me. If somebody has chondromalacia patella, there's a very specific taping. There's very specific tensions that you use. There's movement that you need in order to make it work properly. So education's the science behind the tape. Kinesio tape, when you pull it back and you let the tape recoil, there's already a 10% stretch on the tape. So simple, and I share this with the class. Simple paper off tension is therapeutic, and I don't know if the other classes are teaching it as specific as that. We talk about a lot about biotensegrity,
Mm-hmm.
And how you tell the body how you want to go. So when you're injured, finally, we get, I go into talking about this real specifically about how you can change the dynamics of the body, but you can't do it over a period of time. And I share with people with this all the time is that you've trained your body, your mind has trained your body to do what you wanted to do. All of a sudden you've gotten injured. Now you're coming in, you're getting massaged, you're getting some kinesio tape, but the brain's not caught up to what exactly you're trying to do. So I always say you tape the body, you tape the brain, because the brain now is starting to connect down into, oh, I'm doing something different now. My body's responding differently now, so I have to catch up. And so a lot of science is involved with kinesio, and a lot of very specific stuff is done with kinesio other than the other classes. Now, I'm not allowed to touch any other tape because I'm under contract with Kinesio.
Got it.
So I don't know I know from talking to some of my colleagues that aren't in Kinesio instructors that they use rock tape, which has an enormous amount of adhesive on the back. I've actually had clients come in to get massaged and have rock tape on their back. And they ask me to take it off for them before I do the massage. And I tell them that I'm not authorized to touch any other tape other than Kinesio. So I'll help you, but I can't take this off.
Wow.
I think one of the biggest things that is the biggest thing with Kinesio compared to other is they teach that you have to move your body. Again, I'll go back to what I just said about this client coming in with this rock tape. Chiropractor put this rock tape on his lower back and pulled up with all his might, and then laid the tape down on the erector spinae on both sides of the spine. They actually had to help roll him off the table because he couldn't get off the table because of how much adhesive and tension they put on the tape. Now, as far as KT tape, I've had clients tell me that sometimes it works and from what I understand, KT tape has not enough adhesive. They have too much adhesive. They just can't seem to get the adhesive down correctly. So when you have the backing of the tape and you have the tape itself, it comes together like so, and it has a 10% stretch already on the tape. So it's pretty amazing.
Wow. That's awesome. So is this technique something that you would only use for injuries, or can it be a tool to help posture? I mean, how is it just for athletes? I mean, who benefits from this?
Where we saw where I saw the Kinesio tape really go off was in the Olympics, and ironically, 85% of the population are non-athletic. They use it for posture. They use it for, you can use it for shin splints. If you apply it 30 to 40 minutes before you get in the water, you can use it, there. You can do, like I said, arthritis. You can lower back pain. I've actually gotten so proficient, I can actually tape my lower back SI joint and walk around with no back pain. I can, if I know I'm going out for a run, I can tape myself underneath my knee and displace the tension out of my knee and put, and I can go out and run a few miles, come back and have no tape or no pain. I can take a shower with my tape on. It'll work for 3 to 5 days. I can help somebody who has TMJ. I can help somebody who has had migraines. I've had people who having breathing issues, who just couldn't expand their chest. Their diaphragm was stuck. So I did some taping around the diaphragm itself, and it helped to expand and loosen up their chest so that they can breathe. What else have I done with the tape? There's multiple uses.
I believe it. It's probably hard to find a scenario where the tape wouldn't be useful in some way.
The only time I found the tape not to be useful is, and this was a learning curve for me. When I had clients come in and I would work on them, and then I would run down, I would go into the bathroom, get some soap and water, and I'd wash their legs down, or wherever I was putting the tape. Then I come to find out that they told me that the tape didn't work for them because it didn't stick. And I'm trying in my mind to figure out why. Then I realized that they're using Dove soap with moisturizer in it.
Oh, wow.
So the tape's not going to stick to skin like that. People that use lotion, it's not going to stick. So I met with a chemist. I told him what I needed, and he developed a spray for me. So I named it K-Spray, and I use that. I use it on the skin, and I cleans up all the dirt and debris off the skin, and I'm now able to put it on, and it stays on for 3 to 5 days.
Oh, wow.
So I'll absolutely bring some of that so that the students can actually practice with that as well, so that they can see the importance of the skin. The other where it wouldn't work is if somebody was allergic to the adhesive. Mm-hmm. If you're allergic to adhesive or any kind of like Band-Aids or anything like that, you'll know quickly, because one of the two places that I found that was very sensitive that I taught was right here on the wrist and on the belly itself. So if somebody doesn't know, and I always do this while I'm working on them, I always put the tape here, and I put a piece of tape on their belly. And if they get red pretty quickly, then I know that I can't use that tape. But Kinesio also makes what's called light touch. And yeah, it's good. It's good for people who are very sensitive. That tape is also good for the elderly population whose skin's frail. And I also can use Kinesio tape on the pediatrics.
Wow.
Yeah, it's really good. You can, what's really cool about it is because you have to cut it in order to divert somebody's, like a kid's attention. You can cut a heart and put it on their arm, and they can kind of look at it and see, oh, wow, that's really neat, and smile. And then you can actually do the taping to where they need the tape at itself. So I'm trying to think the other, yeah, there's very few places. I've had women come in that have had from wearing high heel shoes.
Mm-hmm.
They've had the hammer toes.
Mm-hmm.
And I've actually been able to pull the big toe out using a mechanical correction, so that I took a lot of the pain out of their foot.
Jeez, that's incredible.
Yeah,
That's incredible.
I actually have. It's really interesting. I wish I would do more of this, Angie, but I don't. I kind of my wife says you need to write this down more. And I have many clients that are doctors, and I had one of my doctor clients call me and ask me if I would see their daughter. She's the lead dancer in the ballet here in Pittsburgh, and when she goes up on point, she has a tremendous amount of pain between the second and third toe. So her mother took her to every expert in the city of Pittsburgh and surrounding, tri-state area. Couldn't find anything that they could do to help her. So she calls me on the phone and says, hey, could I take a few minutes and assess to see if there's something that I can do? And I said, yeah, sure. So I looked at her, checked it out. I did a mechanical correction around her toes.
Mm-hmm.
She went back up on point and had absolutely no pain. What I found was that right at the end of where the second and the fascia is for the second and third toe,
Mm-hmm.
there was a big strain there.
Oh, wow.
So every time she went on there, it created a lot of pain in that specific area. So what I did is I took and I measured, and I opened up the tape, I pulled it out about 50%. She pushed her foot into, and then we ended it on the top of the foot. And she stood up on point, and she had absolutely no pain. Yeah. And I just, the doctor looked at me and said, I cannot believe that a single piece of tape took my daughter out of pain. And I've had her to all the experts. Yeah. So the other thing that, that I've done over the years in working with Kinesio is I've actually incorporated it into my massage.
Okay.
If I have somebody, Angie, that's laying sideline posture and I'm trying to work on the adductors,
Mm-hmm.
but the leg consistently just won't come down comfortably,
Mm-hmm.
I will take and I will tape the glute medius to inhibit the muscle. And once I do that, her knee is laying on the table, and I can just work on her on a client without fighting that.
Wow.
It's been really, really an awesome adjunct into my my practice. I have again, as a distributor, I also was I TA'd with everybody, and one of the classes I TA'd in was in Dallas, Texas, and it was, I want to say, about 100 degrees in the shade, and this lady bought 2 boxes of tape off me, and she took them out to put them in her trunk to go to lunch.
Mm-hmm.
And I went over and I tapped her on the shoulder, and she looked at me. She goes, "What's up?" I said, "We taught you in there that this tape is heat activated, didn't we?" And she looked at me. She goes, "Yeah." I said, "Well, you're about to throw away a lot of money because you're going to stick your tape in a trunk, and it's 100 degrees out here. it's going to be 120 in that trunk. She goes, oh my God. So that's a lesson I had to learn on my own, because I left my tape when I left my bag in my car, and the tape was so ineffective. It was awful.
Oh no.
So those are some of the things that I will go over in class. I'll let everybody know. I'm always good to share my mistakes with people. That way they can see that even though I've been in business for 30 years, I still make mistakes. And, we all make mistakes, and let me share with you what I did so that you don't make the same mistake that I make.
Yeah, I understand that. And I think that's so important for students to hear that, so that they understand that, hey, we're all human, and here are some things that went wrong, and hopefully you don't follow suit.
Right.
Along with what obviously you're going to be teaching in person, are there any resources that the participants will have after the class is over? Anywhere will they still be able to reach out to you with questions, or how does that work?
Yeah, first off, when we're done with the entire class for the weekend, they will have, I believe Kinesio gives you 30 days access to their resources. So you can go to the Kinesio website, and they have a menu bar, obviously, across the top, and you have access to that for 30 days. There's tons of different ways that people tape. There isn't just one way of taping. I've seen so many different tapings, and the times that I've been in the years that I see a tremendous amount of tapings on Facebook. And I'll be honest with you, Angie, I take quite a few of those, and I try them. And as far as access to me, there's not a person that I've taught. I taught at the Pittsburgh School of Massage Therapy from 2000 to 2014. I taught their orthopedic and pain management class there, and I give my card out to everybody, and I say, there's not a person that I teach that I'm not going to say, oh, well, I'm done with you now. Mm. I have absolutely. I have. Call me. All I ask for is 24 hours to get back to you, to give you some, give you some advice, give you something to think about. And yeah. And then, like I said, Kinesio has resources that you can go to for the 30 days. And then they give you an option to, there's certain things you can, and I'll tell this class this. There's so many different things you can do. You can become a certified Kinesio tape practitioner. There's a certified Kinesio tape technician. There is Kinesio tape if you're into the equine.
Oh, wow.
They have equine. It's a very specific tape geared towards horses. Yeah, they're a very diverse group. Dr. Case's, we call him the Mad Hatter. He's just constantly looking for research. And I think, going back to one of your earlier questions, I think that's one of the biggest things, Angie, that sets Kinesio above and beyond most other tapings, is that he always goes after the science. He's constantly researching. And I think, and documenting, he documents everything. And he goes over, he does case studies, he does blind studies, he does so many different things. And that's why I chose the Kinesio method more than anything, because of that. And I can see, I see results.
Awesome.
I had a very, very close friend who had bypass surgery. And normally it takes, 4 to 6 months to get back to the office. He's back to work in a month.
Wow.
Mm-hmm.
That's incredible.
Yep. He when I first saw him, he had me come in because he had a few bruises on him. Mm-hmm. And so I in the past I've taped him for the bruises. And I had a real quick story, and I'll get back to my friend. I had a lady who's 78 years old, and she had a real bad bruise on her shoulder. And I said to her, Susan, how long is that going to take to get rid of? She says, oh, 2-3 months. It was black and blue and it had crust. That was that bad. Damaged, very damaged. So I put a fan cut on her shoulder and I did a crisscross fan cut. She came back the next week for her session, and where the lines were, you could actually see that it had drained the bruise completely out. So I put tape on her right before she left, and she came back for her session 2 weeks later, and the bruise was completely gone. So it was gone in 2 weeks, not 2 months. It was unbelievable. So getting back to my friend Bob, when I first met him, I went to take care of his bruises, and he looked at me and he says, I see you got a look in your eye. He said, what are you thinking? I said, I can help you get that swelling out of your legs. He looked at me and says, show me. I had him up, like I said, walking probably within a week. Almost all his swelling, because he had his lower leg looked like his thigh. Yes. Yes. And so, there's other bits and pieces to it that that went with it, and I'll bring those pictures. And, I actually even have, there's a video out there of me actually interviewing him for Kinesio. So yeah, that was really very interesting. He spoke about his experience. The other thing that this is really good for is post-op surgery. I had a client who had full knee surgery. Quad and hamstring were so blown up. It was bad. So I went over and I did nothing but Kinesio on above her knee for a week. And then after that, I went and I did Kinesio above and below the knee. And within 2 months, maybe even closer, just walking around pain-free. She had home PT, and her PT looked at her and said, I've never seen anybody get better this fast. That's why I'm saying, Angie, it speaks for itself when you talk about Kinesio. What else have I done? There was a class that I taught in where was it? Lancaster. Mm-hmm. And one of the participants, she came up to me and asked me if I could she could talk with me afterwards. And it was her daughter. I don't know if you can envision on her quads, she had all this redness and blotchiness on her quad, and nobody could get rid of it. She couldn't get rid of it. Her body wouldn't, move it. Mm-hmm. So I called it. This is where it was out of my scope of taping. So I called a colleague of mine, and she shared with me how I should tape her. And so what I did was I understand that the two biggest portals in the body are in the belly and in the back. So what I did is I did these really long fan cuts, and I covered her entire quad with fan, but I anchored it in the belly. Her mother said probably within a week, 10 days, because I showed her how to do it, mm-hmm. that all that red and blotchiness was gone. And nobody's been able to get rid of it. Not even the experts. Angie, I can seriously, yeah.
That's awesome. I'm so excited. I cannot wait for this class, and I'm so excited we're able to host it and have you come in and teach this. So I am telling everybody I know who's a therapist out there to check this class out. It's a 2-day class. It's 16 continuing education hours. And it sounds like it's something that is just going to benefit everybody, every client that you see. So I am stoked. I'm really excited. Anything you want to leave us with? Last thoughts or comments about the course?
I think if you want to set yourself apart from other massage therapists out there, having tools like Kinesio tape on your belt can be a game changer. I've gone to sporting events where I use this, and it's totally amazing to see people's faces, reactions. There's times where I don't have to do the massage itself. I can do the Kinesio tape, and we can call it a day. So I would definitely encourage this class, because it just speaks for itself. And it just, with everything else, Angie, there's a cost to it, but you can get that money back. I'll teach them or share with them how I charge for taping.
Awesome.
It's one of the biggest questions I get is, how do I charge for taping? There's so many different ways you can charge for taping, and I will be happy to share that with them. And I'm trying to think if there's any other. No, I really can't think of any other. I'm excited.
That's awesome. I am too. So thank you so much, Scott, for joining me today. And I am excited for December. And if you want more information, please log on to our website at fireflyhollowwellness.com. You can also reach out to us through Facebook as well. And we look forward to seeing you.